Hi, this is Dr. Karen Becker. Lungworms are parasites that have the ability to infect the respiratory tracts, or the lungs and windpipes, or tracheas, of dogs and cats. There are several different parasites that fall into the category of lungworms. So some can infect dogs, some can infect cats, and some species can infect both. Dogs and cats that roam freely outdoors in certain geographic locations in North America and elsewhere are at highest risk of acquiring lungworm disease. For example, the cat lungworm, Ailurostrongylus, is found throughout the southeastern United States. Infection typically occurs when a dog or cat is exposed to a host animal that carries the parasite. So pets that hunt and eat prey outdoors are at greatest risk, as well as those that drink water from infected ponds or freestanding water that may contain the larval phase of the worm. Once ingested, the worm larvae travel out of the intestines via the bloodstream and then to the lungs, where they grow into adult worms and lay eggs. In the case of the tracheal worm, Oslerus osleri, infection in dogs can be transmitted directly from the mother to her litter while she's licking her pups, or when they come in contact with her infected feces. Many lungworm parasites are found near lakes where crayfish, snails, and slugs are host. Crayfish and snails are actually eaten by raccoons, so that a dog that comes in contact with a raccoon or the raccoon's poo can also be exposed. Cats are more likely to acquire a parasite when hunting birds or small mammals that have eaten infected snails. Significant lungworm infections are most often seen in pets under 2 years of age that have heavy worm burdens. While there are many species of worms that can infect an animal's lungs, the most common parasite seen as dogs is the tracheal worm, Oslerus osleri. In cats, 2 of the most common prevalent worms are Capillaria aerophila and Ailurostrongylus. Symptoms of all of these worms are pretty similar. The infection really depends on the specific type of parasite, how long your dog or cat has been infected, the severity of the infection, and what his or her own immune response is doing. Pets with mild infections often have no symptoms, or they may experience just some very mild coughing, maybe some lethargy, exercise intolerance, or weight loss. In severe infestations, where there are a large number of worms, complications can be greater, like shortness of breath, bronchitis, emphysema, fluid buildup in the lungs, and actually pneumonia. Interestingly, dogs that have recovered from lungworm infection are thought to have some level of immunity against future exposure, which is very, very rare. That doesn't happen with other parasites, so that's unique. The veterinarian will take a complete background, a medical history on your pet, then perform a physical exam that involves listening to the lungs. Your vet will complete a CBC and some chest x-rays, as well as a fecal check to check for the ova or the larva of these worms. Respiratory secretions can also be evaluated through a procedure called a transtracheal wash. A test will also be performed to rule out heartworm disease. Traditional treatments for lungworm is an anti-parasitic drug, but integrative veterinarians also use some really great adjunctive therapies, including ozone treatments and essential oil inhalation therapy, as well as oral cat's claw and turmeric. Making sure to recheck stool samples to make sure that the infection's gone is also a really important step in making sure that you've cleared active infection in your dog or cat.